Some of you who have been in the office recently may have noticed that we have expanded our oral cancer screening to include the head and the neck and a little bit more of the pharynx due to the occurrence of oropharyngeal cancer is on the rise. So today I was just going to show you some of the things that we are doing a little differently. Most of you know the usual oral cancer screening, but today I'm going to show you some of the things we're doing to help find other cancers. So the first thing we're going to do is we're going to look at the head and the neck, and I'm going to ask Teresa here to stick her tongue straight out and straight up. Okay, do it again please, and we'll examine that. Okay, next we are going to do a thorough head and neck exam. So Teresa, if you could turn your head to one side, I'm going to check her neck here for any lumps or bumps or persistent sores under her chin, even behind her ears. Very few people have anybody looking behind their ears. Teresa, if you could lean forward. I'm going to check the back of her neck. Everything is clear here. No lumps or bumps. And if you turn the other way, I'm going to check your neck here. Okay, we're even going to check a little bit on her head to see if there's anything there. And everything looks good. And so I'm going to ask you, Teresa, have you noticed any lumps, bumps, or persistent sores in or around your mouth or your head?
No.
Okay, good. I'm glad to hear that. So that's a little bit different than what we usually do. The other thing that we're going to do, and I'm going to switch gloves now because we've concluded the extra oral portion, is we are going to use a couple of tongue depressors to really look down at the throat and around the edges of the mouth. And now, put on our mask. We'll get our light positioned. And Teresa, put your head up, open. No, don't stick out your tongue. Just relax. And say ah for me.
Ah.
Okay, and once again.
Ah.
And once again.
Ah.
Okay, and that concludes the new changes in our oral cancer screening.